Well, for the first time ever, a Vanderbilt eye surgeon is able to tell people with serious eye injuries, don't panic, we can rebuild it. Until now, if a chemical injury left the eye scarred and the vision blocked, there was very little that could be done. But Dr. Ming Wang is one of a handful of surgeons doing a new surgery to rebuild healing power back into the eye. Health specialist Carol Hauser joins us with good news and some bad news about this.
That's right. The insurance companies are not wanting to cover this, as is often the way with new procedures. That is what happened to our patient, Thomas Brewington. He got cement mixed in his eyes 16 years ago, and he was looking for an option to restore the vision to one eye that was blinded. Now, the good news is this procedure is being called the first success, and it is now considered the only option to restore vision to these severely injured eyes. 1 year ago, we met Thomas Brewington as part of a story about an amazing vision-restoring surgery, but his insurance company was refusing to cover it until Dr. Ming Wang sent them a copy of our story.
If it hadn't been for your report, it might have dragged on for a whole lot longer.
The company finally changed its mind, so today, Brewington finally got the chance he has waited 16 years for.
I'm nervous, excited, and don't know what's going to happen.
A corneal transplant just does not work for people like Thomas. Scar tissue regrows quickly, covering that new cornea up. But Dr. Ming Wang's new surgery takes things a step further. The clear disc that looks a lot like a contact lens is the new cornea, but just to the right of it is a donut-shaped piece of tissue that can work magic for Brewington.
This donut-shaped stem cell will prevent the blood vessels and scarring from growing and scar up the cornea transplant in the middle.
It's a ring of cells from the donor eye called stem cells. They block scar tissue from growing back over Brewington's new cornea.
So what we'll do, it will serve as a guardian soldiers to protect the central cornea graft clear.
For the rest of my life.
For the rest of your life.
That is so good.
Yeah.
Now, just days after surgery, things are looking good.
I got the 20/40. Sure did.
His newly rebuilt eye has a 60 to 70% chance of keeping his vision clear for the rest of his life.
For Thomas, he has been really not seeing well at all for 16 years with all these problems. And today we got him to see 20/40. I mean, that was really a miracle. And
there is still a 30 or so % chance of Thomas Brewington's eye scarring over yet again, but that's far better than the 0 odds of success that he had before this procedure. Just goes to show you, if you stand up for yourself to insurance companies, they often will choose to do what is right. Sometimes it just takes maybe a good doctor to push it through and a whole lot of patience.